Hi, Mr. Gonzalez.
Hi, how are you?
Hey, how are you? Mike Greco from Anesthesia. How you doing today?
Good, pleasure to meet you.
I'm the nurse anesthetist. I'm gonna give you anesthesia today for your surgical procedure. Could you say your name for me, please?
Sure, it's Juan Gonzalez.
And your date of birth?
4/19/1991.
Okay, who's your doctor?
It's Eileen Thomas, Dr. Thomas.
And what are we doing for you today?
I'm here in regards to screws in my wrists. I believe they're going to be taking them out on my right wrist.
Okay, on your right wrist.
Yeah.
Okay. How old are you?
I am 28.
Okay. Mr. Gonzalez, I'm just going to ask you some questions so I could do your anesthesia safely today.
Okay.
You have any high blood pressure, heart disease, lung disease?
No, none.
Any asthma, bronchitis, COPD, difficult breathing?
No.
Any head or neck problems?
No, no.
Any problems with your groin, abdominal pain?
No.
How about any diabetes?
No.
Sugar problems?
Not really.
Any problems with your extremities, your arms or your legs?
No, none.
Okay. Any asthma, bronchitis, sleep apnea?
Sleep now.
Okay. Have you had any surgeries before?
Just when they put in the screws in my wrist.
Okay, and when was that?
About 2 years ago.
2 years ago.
Yeah.
And what type of anesthesia did you have at that time?
Honestly, I don't remember.
Okay, did you go to sleep?
Yes, I did go
You
to sleep.
did go to sleep,
Yeah.
so you had general anesthesia.
General.
Do you know if you had any problems with the anesthesia at that time? Maybe develop a high fever, post-op nausea and vomiting?
No.
Do you know if there's any anesthetic complications with anyone in your family that maybe underwent anesthesia?
No, none.
Okay, any allergies to medicine or food?
Probably just milk. I tend to get like a nauseating feeling.
So you
but-
get nausea after you,
Yeah.
you drink milk. Do you eat cheesecake?
Every once in a while, but I tend not to because of.
Of your stomach,
Dairy,
so just a little
yeah.
irritation, but not really a true allergy.
Oh, I
right?
guess it's not. Yeah. I guess.
Okay. Do you have anything to eat or drink today?
Well, they told me not to eat after midnight, so the last time I ate was around 8 p.m.
Okay, what'd you eat?
Something light, nothing too heavy. Yeah.
Do you take any medicines every day?
No.
Any vitamins?
Sometimes vitamins, but not really.
What types
no.
of vitamins?
Just regular GNC, over
Okay.
the counter.
All right. Now, do you smoke?
No.
Okay. Any alcohol use?
No, not
Okay.
heavy.
Any drug use? I'm not the police. I'm just asking you so I could give you anesthesia safely.
No, definitely. No,
Okay.
no drugs.
I'm not going to your party. All right. Let me ask you a question. Could you stick your tongue out real big for me?
Sure.
Okay, close your mouth. Put your head all the way back and bring your chin to neutral position. Touch your left shoulder and your right shoulder. Any pain in your neck when you do that?
No.
Okay. Just here. All right, great. So you're having hardware removed from your right wrist today by Dr. Thomas.
Correct.
Since you're healthy and you have no medical problems, how tall are you?
I'm 6'1",
6'1", and you weigh?
about 195.
Since you have no medical problems, you're healthy, probably what we're going to do for you is I'm going to give you a peripheral nerve block.
Okay.
And what we're going to do is I'm going to give you some medicine to get you nice and comfortable and give you a little local anesthetic just under your arm.
Oh, do you really have to like poke me with something? Like I would rather just you put me down. Like, do I have to get injections? Or
Well,
anything?
I'll tell you the option is I could do that. It could provide some numbness to your arm, which could give you post-op relief. But some patients don't really want the needles placed in. They have a fear of them.
I definitely do. I don't think I want a
Okay.
needle placed in.
So what I can do for you since you are healthy is I could give you general anesthesia.
Can you?
So what I'm going to do is I'm going to bring you in the operating room. I'm going to put you on a heart monitor, a blood
Okay.
pressure cuff, and an oxygen monitor on your finger.
Okay.
Okay? I'm going to have you lay down on the narrow operating room table, and I'm going to give you a mask.
Okay.
I'm going to turn some oxygen on now. The oxygen has no smell. It's probably just going to smell like a balloon.
Okay.
All right? Have you take some nice deep breaths. While you're taking the nice deep breaths of the oxygen, I'm going to give you medicine through the IV, and you're going to go off to sleep.
Okay.
Now, when you go to sleep, I open your mouth and I put a little breathing device that sits in the back of your throat.
Okay.
I take it out before you wake up. Now, the only way that you may know the device was there is you may have a little dryness or sore throat for the next 24 hours. That's normal.
Okay.
We tell our patients to take lozenges, cough drops. That relieve any discomfort you may have.
Okay.
All right? I'm with you the entire procedure. I make sure you're comfortable, and I make sure you're safe, and I make sure I'm giving you enough anesthesia so that you have a good experience and you're comfortable. When you're done, you're going to come to a recovery room and give report to another nurse. And at that time, I'll report off on you and tell her how the anesthetic course went, and I'll write for some pain medicine. Now, you should be very comfortable when you go to the recovery room. However, you are having surgery and you may have a little bit of pain. If that's the case, you're going to ask the nurse, and she's going to provide the pain medication to you.
Okay.
All right? Now, is there any questions that I can answer about your anesthesia?
No, not as of now.
Okay. I'm just going to look over your labs
Okay.
and some of the other paperwork. I'm going to go back to the operating room, make sure I have all the equipment that's needed to take care of you safely,
Okay.
and then I'll bring you in.
That sounds
All right?
great.
So
Okay.
you got your IV, so we're good to go.
That's
All right.
great. Thank
I'll see
you.
you soon.
I
You
appreciate
got it.
it.
My pleasure. Thank you.